Hello, everyone. Thank you for joining us. My name is Ty, and I will be your co-moderator for today's 30-minute program, How to Ensure Safety Maximizes Its Budget, presented by Safety News Alert and sponsored by Avetta. If you have any questions during the presentation, please type them into the chat box in the control panel. Now I'd like to introduce your moderator and speaker, Sarah Lutz and Kevin Lombardo.
Thank you, Ty. All right, we have a special guest today. Kevin Lombardo is from DORN. He's the president and CEO and part of the board of directors of DORN Companies. It is a wellness-based pain management company and an early intervention prevention evidence-based specialty provider that helps reduce employers' costs. He has vast experience in environment, health and safety, injury prevention, wellness, safety, technology, and remote workforces. His expertise includes safety excellence, operational improvements, technology implementation, strategy, and leadership. Thanks for being with us today, Kevin. I appreciate it.
Thanks, Sarah. Appreciate the introduction and glad to be here. Trying to stay warm. We got our first snow of the season today.
Awesome. All right. Well, should we just jump in? I have 5 questions for you today that we'll go over.
So why don't we do that maybe first, if maybe just get out of the way a little bit, remind everybody about Avetta, and then I'll introduce DORN, and then we'll get the shameless plugs out of the way and dive into the questions.
That sounds good. All right. So Avetta is a supply chain management platform. We help companies reduce their risks in liability, financial, cybersecurity, health and safety, and many other areas. So if you'd like to learn more about Avetta, please go to avetta.com. And Kevin, I'll let you go ahead.
Great. Yeah, I'll keep this short and sweet. Appreciate Avetta inviting us on here today to speak about how to get safety more visible in the budgeting process. Budgets aren't the most exciting topic in the world, so we'll try to keep it as engaging as possible. But to quickly introduce DORN, DORN is, as Sarah said, we're a wellness-based injury prevention and ergonomic organization. We've been around for about 22 years now. As you can see, we've worked with about 120,000 employees during that time, and we've saved employers over $100 million. And the big thing is that what we do, it has an annual ROI of 300 to 600%. We are national in scope, and in addition to that, we do have partners that we are able to go internationally with any organization as possible. The one organization we work with has ergonomists in 64 countries that we could tap into at any time. The last slide that I want to show is kind of really what we call our integration model. I'm not going to read anything that's on here. Really, though, what it really does is it's, those arrows are really, it's a wellness mindset that we want to bring to people, whether we're doing biomechanics training or ergonomic assessment, hands-on deep tissue work to eliminate pain and discomfort, fit for work testing, whatever it might be, or any of our technology solutions. We really want to bring the mindset of wellness, because we believe that once you get people engaged at where they're at, meeting people where they're at, it changes the dynamic. So we're not just another safety program, injury prevention program. We're really a engagement program. You can see the line at the bottom. It's more than just a marketing tagline: empowerment through education and engagement. It's a belief system. It's how we do things. And the more you can get people engage and educate them, you're empowering them. And once you empower people, the dynamics change tremendously. So with that, Sarah, let's just jump right back into the questions and go from there.
Sounds great. Thank you. Okay, so the first question is, how should safety directors go about making decisions for safety programming during budgeting season?
Great question. We're in budget season. Some folks are probably in their second or third round already. I think it's really, there's 2 focuses here. One is data. We're very data driven in what we do and what we work with organizations. So it's important that safety directors understand their data. their incident rates, their near misses, their actual worker comp costs. We do run into a lot of situations that the people we're talking to may not have access to all that data. So we do believe it's important, if for some reason worker comp costs are handled under HR or something, form that partnership so that you have access to that data. So you have to understand your data. You have to understand where your risks are. And once you have that, then you have to set out what your objectives are. What are you really trying to accomplish? We all want to say we want an injury-free workplace. Great, but what does that really mean? Do we want near misses to be cut in half, or do we want a zero tolerance level? Do we want incidents to be 30% reduction next year? What is the objectives? And then once you define the objectives, you have to set out to say, what programming do we have already that we need to enhance or put more to the forefront? And two, what other programming don't we have that we probably need to have? Now, I will tell you, one of the things that we are seeing a lot more of today than we ever have in the past, and I don't know if it's a hangover from COVID or whatever it might be, but the reality of what we're seeing is we're being asked to do more higher level ergonomic assessments. So when I say ergonomic assessments, it's not going with the stopwatch and looking at revolutions of the machine or whatever it is, or an office assessment for office setups. It's more of a site level. It's more of a risk assessment to identify where those risks are. We have the data, but when we want to define what programming we need, sometimes, especially if they don't have the expertise in-house, you bring in a group like us and we look at it and say, okay, your real issue here is body mechanics. Because of the nature of the job, people are lunging, people are squatting a lot, whatever they're doing, and they're doing it poorly. So maybe that's where the programming needs to be. Maybe it's we have a tenured or an aged workforce, and that creates risk where, my father worked in a factory for 40 years, and I think he took one sick day off. And so whether he was in pain, hurting, whatever was going on in life, he was at the job, and people still work that way. So they carry that in them. So maybe they need some type of deep tissue work, or maybe they need some technology support. Maybe we want to get more data, right? We want to get granular when it comes to the ergonomic side of things. So maybe we want to test drive wearable sensor technology or motion capture technology, AI technology. I'm not here to tell you which one to do, but you have to think about first, not just the data with, hey, here's our injury rate, how do we reduce it? But maybe get that risk assessment. Maybe you look at the site and say, technology can play here, some on-site support can play here. Hey, we have programs, we just have to put them more in the forefront. So kind of a long-winded answer, but I think it's really define your objectives, and the way to define your objectives is really look at your data, make some high-level strategic, because higher in the organization, all they care about is the data. But at your level, you need to look at and say, okay, maybe we don't have all the programs, or maybe we don't even know what programs to utilize. So let's get that risk assessment. So hopefully that helps there.
That's great. I love that. So understand your data and your objectives, and then that will lead the rest, right?
Yeah, I think once you have that, sometimes you know where to go because you already have programs in place. So you just need to maybe have more emphasis. Sometimes you don't know where to go with that, right? So that's where you bring in somebody like us, where we do that high-level risk assessment to help lay out. We've just done it, I think, 4 to 5 times in the last month with different types of companies, from distribution to a cancer center to an auto manufacturer. They didn't have an idea of which programming was needed. So we did that higher level risk assessment to help them to decide which programming they needed. And sometimes it's us, sometimes it's not us, right? Sometimes they have programming in place and we look and say, hey, you have a best practice over in facility B. All you need to do is leverage that over in facility A and C and D, and you're good to go. In other cases, they just didn't have the programming. So that assessment, I think, is really critical.
Definitely. Now, what about companies who are in cost-cutting mode due to factors like the pandemic, a recession, or other economic challenges? How do we ensure that there's still room in the budget for essential safety programming?
Yeah, good question. A really good question. So With this one, I'm going to say a few things because I used to work for a very large public company. I won't say their name because about what I'm about to say. But what would happen is things are going along fine. Second quarter comes and all of a sudden budgets are cut, right? And, we're not making the number, not making the top line number. So everybody's got to cut their budget 10%. I will tell you, when I was a division president, I fought extremely hard not to get the safety portion of the budget cut. I could do other things. We've talked about it in our company in DORN, and we're not a big company. We just talked about it as a team yesterday. Hey, how do we, if there's a recession coming, which everybody believes there may be a recession coming, which then becomes a self-fulfilling prophecy at the end of the day. But the reality of it is there may be one coming. So how many trade shows can we go to? Don't know. So if we can't go to trade shows, how do we use some of that money, not all of it, so we save some money? Then we think about what's other ways to reach people. So that's more of from a marketing and sales perspective, but reality-wise, from a safety perspective, I think the first line of defense would be fight like hard, because if you know your data, where that your injury rate is X, figure it out, drive it. The other thing too, enhance your data. Excuse me. What I mean by that is when you think about soft tissue issues, which are the biggest driver of ergonomic risk and ergonomic injuries, workplace injuries, is soft tissue issues. Don't just look at your worker comp costs. Go talk to your HR, your benefits people, because the study shows for every dollar there is of worker comp for musculoskeletal soft tissue issues, there's $5 to $7 sitting in your healthcare costs that are non-occ med. That is, I said it's snowing today. If I have to shovel, oh, I hurt my back. I hurt my back shoveling snow, so I might be going to the chiropractor. That's not an injury, but what it is, it's a cost. So again, know as much as you can so that you could say, look, if we're in a cost-cutting mode, let's go invest where the dollars are needed to cut the cost of our musculoskeletal soft tissue issues. We have a client, 10,000 employees in North America, $3 million a year in soft tissue issues in workers' comp, 22 million in the healthcare costs. Safety and wellness programs should not be where the first line of defense is, so where you cut. But let's say it is. Then you got to think differently. That's where you then do a couple of things. Number one, do the assessment work, because that's less expensive than having full-blown programs. Do the assessment work so you understand where those risks are, and if you have a good company that's doing that assessment work, they're quantifying that assessment. They're not just saying, oh, you got poor body mechanics over here. They're quantifying it. They're doing it in a way that they're giving you risk scores. They're giving you details that say, okay, you all can figure out what you need to do and where you can invest your money, but here's your risk. Two, look for alternatives. There's virtual solutions, there's on-demand solutions that are less expensive. They still can reach a broad audience, but maybe they're not going to have the same effectiveness as somebody like us being on site where we're working with people week in and week out. But we also have those virtual solutions. We have those on-demand solutions. We have those other ways. And I'll give you a good example. It's a little bit unrelated to the cost cutting. So I'll give you two examples, one on the cost cutting, one on the non-cost cutting. On the cost cutting, we have a client said, hey, we believe we're going into a recession next year, and we think we need to, hold the line on our costs. The word is hold the line, but in reality, the math worked out that it's about a 6% reduction for us. I said, okay, I get it. I appreciate that. We're all in this mode. So we looked at it and said, well, we have certain sites that we don't have the traction of the level of people that we're seeing, so we probably can't staff it the same way. But that being said, I didn't stop there because that would just be taking away something from that client. We have a virtual solution for them, a live on-demand, live virtual solution. So for those locations where we don't get a lot of people, maybe we don't staff it on site. Maybe we staff it virtually. And we're opening up that conversation so that at the end of the day, they can realize their goals of holding the line on cost. I can realize my goals of maybe not getting a 6% hit. Maybe it ends up being a 3% hit. I can live with that more than I can live with a 6% hit, right? So that's from a client who says, we're holding the line of cost. Two, we pitched a major airline last year, and we're now re-engaging in those conversations. They said, well, we have hubs all over the country. Some have 5 people, some have 20,000 people. And this isn't about cost cutting. It's getting solutions that can reach as many people as possible the most cost effectively. So sometimes it's train the trainer. Sometimes it's those virtual solutions I was talking about. Sometimes it's on site. If you got 20,000 people, you probably need a number of DORN type people on site. So it's not about selling a singular solution. It's about looking at it differently, because you can still meet your goals of investing in safety to not hinder the impact that might happen if when people have a catastrophic injury, both health, worker comp wise and non-worker comp wise, carpal tunnel, whatever it might be for the office people. And there's other technologies, desktop office technology, so forth and so forth. There's multiple ways to get there. So to me, first line of defense is know your numbers so that you can fight for that budget. But two, if the reality is, hey, we're holding the line or we're reducing 10%, that's okay. There's ways to get there. Just don't forego the support that people need, because once that catastrophic injury happens, everybody's going to have eyes on you as a safety director or safety manager and say, well, what happened and why? And the reason you cannot say is, well, you cut my budget, because that would not be a good conversation to have with the CFO or the CEO or the head of operations, because they don't remember that anyways, right? It's 6 months from now. It's, it's what did we do differently, alternatively, to get the same results?
Love it. Great advice. How do you ensure that your safety plans have buy-in from senior management and executives during the budgeting process?
Well, if we're in the budgeting process and we're starting that conversation, honestly, we're probably too late. That has to be an ongoing conversation. I know that, in a lot of organizations, we have a client, we're in 18 locations. Monthly, we're giving them data on certain things. That goes to the corporate safety director, not just the site person, the corporate person, who then brings it to the organization. You have to have, and I will tell you, most large organizations, safety is the first slide in any presentation. When I was working for a very, very large company, a $50 billion company, and I was a division CFO, the first slide I had to always present when presenting to corporate was our safety record. So in large organizations, it's usually part of the DNA. As you get into other organizations where maybe that communication rhythm and structure isn't part of the DNA, I'd say start bringing it as part of the DNA. First, start with whoever you report to. Create a rhythm monthly. I'm going to go through our numbers. I'm going to go through, if we have a company like DORN on, I'm going to go through the DORN results. I'm going to go through the training that we've done, and did the training take, and are we seeing changes? You have to start that conversation throughout the year, because if you're identifying those risks throughout the year, then when you come into budget season and say, hey, I think we should be looking at sensor wearables or motion capture and so forth, the theory isn't, well, I saw it at a conference and I think it's cool, we should do it. It's during the course of the year, we've identified in this department through ourselves or through our partner DORN, hey, we have these issues that just consistently are seen. So, and we've done that assessment, and we think exoskeletons, wearable technology, exoskeletons could be a help here. And we've studied it, and this is why, and the investment is X and the return is Y. So the conversation has to be an ongoing throughout the year conversation. Now, for those of you who are, again, in that position where maybe that conversation hasn't happened, I would tell you, and it's going to sound like I'm saying the same thing over and over, but honestly, it's real. Do the assessment. $3,500 to $5,000, do the risk assessment, understand where those risks are so that you can have that and bring that to the senior leadership team. Sometimes people have that ability to influence that conversation internally. If not, we are glad to sit at the table with them to be the independent, arbitrator and say, here's what we're seeing, and here's the 5 ways you can address it. They got to have that internal conversation. So, have the conversation throughout the year, but if you haven't, get yourself that assessment so that you can have that conversation. Oh, and by the way, have a broad enough audience. So it's like I said, you can start with your boss, but the audience has to be broader. It has to be line managers. It has to be HR. It has to be CFO. It has to be risk management, depending on the titles in the organization, CEO. It has to be broad enough. And if you have if you're a smaller company and you didn't have that structure and you have a newsletter, make sure you got an article in there once a quarter about the safety results. Make it visible. Put the posters up. People have productivity posters up by equipment. A lot of companies have the safety scores. If you don't, get them up there. Let's make everything as visible as possible. If you don't have that structure to have those conversations, make it visible. But then I would tell you, have the informal conversations. Go to lunch with the CFO, because that's the person you really need as an ally, not just your boss, head of operations, head of HR, whoever you report to. The CFO's, the one who's can, and I've been a CFO in past lives, can stop investments from happening. But if you get them on your side, they will make it go through as quickly as possible. And I'll give you one quick example. We'll move on to the next question. One of our clients, we were out in California in 2018, and we're doing a pitch. We're in 6 sites right now. We started out at 3 in California, and I'm pitching to 2 of the sites that were together. Got all the ops people there, the safety people doing their thing. They happen to have the CFO sitting there. I would tell you, probably halfway through the conversation, he stands up and he said, folks, basically what I see, if these guys, pointed to me, if these guys can deliver what they say they can deliver, you're talking about the elimination of basically 2 injuries. And at the end of the day, you more than paid for that program. You've got my support. And he walked out of the room. Now, when they liked the program, now when they had to put together their internal proposal, their return on investment, all that, they already had the CFO's support. So it was able to get through the system very, very quickly. So create those informal relationships as well, because they're very, very important when you're trying to go and do something new, especially, or hold the line. Like I said, if the company's in cost cutting mode and you want to hold the line on the investments. So have those formal, informal, various ways of communication.
Awesome. Yes, those informal conversations are so important.
Absolutely.
Yeah. It looks like we only have 6 more minutes, so I guess we could always go over a little bit if people want to stay on, but we have 2 more questions. How do you combine EHS and wellness into a holistic safety program when preparing your budget?
Very good question. And let me know if you could see a slide that I just put up.
Yes.
It says next steps to brighter future.
Mm-hmm.
Good. So I'll just put the whole thing up. I'm not going to read it for you. People could read it. So what's happening is the world's changed. EHS people are no longer mainly focused on safety. They're focused on infectious diseases, which we saw for 2.5 years. They're focused on mental health and wellness. They don't have to be experts. And we could have a whole webinar just on mental health and wellness and the impact on ergonomic risk. But again, you have to have a more holistic view. We have 2 taglines we believe in: empowerment through education and engagement, which I talked about. The other is NIOSH's total worker health. 2 weeks ago, I was at the National Institute of Health, NIH, speaking on just this subject. It was more about the technology that's coming into play, but I was also talking about mental health and wellness. So NIOSH is total worker health. I subscribe to it. We're a firm believer in it. Everybody should go and at least research it, because they're awesome. It's a government agency, NIOSH. They're part of OSHA. They're part of National Institute of Health. It's a focused approach, a more holistic approach of looking at people and looking at employees and looking at teammates, because all these things now, as you can see, from ergonomic risk, infectious disease, wellness, mental health, technology, we're a connected world, not just connected because I talked to a partner in Singapore the other night. It was 9:30 here, it was 9 a.m. there. I'm connected that way, but people are connected. They're wearing equipment, their machines are talking to computers. So all these things now have to come into play when you start thinking about safety and wellness. So the role of EHS, and I'm speaking about this, the slide happens to be for anybody going to the National Ergo Show in 2 weeks. I'll be speaking there on the 9th at, I believe, 11 o'clock on this subject, the future of EHS. But the takeaways, there's obviously a whole hour-long talk there, but the takeaways: embrace the new frontier of total worker health. I firmly believe that's going to be the next phase that EHS people really have to get their heads around. Build those internal partnerships. We talked about it, even engineering, increase and diversify education throughout the organization. Here's the next line: ergonomic action teams versus safety committees. And you can have wellness teams that are part of that team. The reason I say ergonomic action team, and I will shameless plug, I did not invent this. We have a client. We're actually talking to them in a couple hours, reviewing something. We went down there and trained frontline people on ergonomics 101, how to be aware of risk, how to identify simple solutions that are not cost prohibitive. They call them ergonomic action teams versus safety committees because they want them to take action. So the more that you can start building this and supplement internal with external expertise, that's where you don't have the expertise, find the expertise. But if you think about this, the world has changed and the role has changed. 2 years ago, the first year of COVID, we had 15 EHS directors together, and we were talking about infectious diseases and stuff like that. And one of them said something profound. He said, "Yeah, the H of EHS, the health side, is probably 5% of what I did, industrial hygienist, all those type of things." He said, "Right now it's 200% of what I do," but they all thought that whenever COVID kind of subsided, it was probably going to still be 15, 20, 30% of what they do now, because the issues of mental health, the issues of stress. If you think about things, we live in a politically divided country. You have political unrest, you have social unrest, you have a lot of different things that impact people, creates risk when they come into the workplace. So take that holistic view and really educate yourself, and then educate your organization and be part of this. So that's kind of my thought on that, if that helps.
That's great.
Anything else? I know we had about a half hour. I don't know if there's any questions. I can't read the chat, I'm sorry, but if there's any questions, be glad to answer those.
It looks like we have time for one more question, and that is, things in the safety world have evolved a great deal in the last 2 to 3 years. What are some differences you've seen in how employers are planning their safety budgets?
Sure. I'd come back to that slide where things are different, right? We're thinking about infectious diseases. Everybody went through great lengths to protect their employees during COVID. What we're seeing now, or what we actually recommend now, is don't let those protocols just totally fade away. You might have to modify back a little bit, but when we're on site still working with people, our people still wear masks. I am proud to say we have achieved over 30,000, somewhere around 35 to 40,000 service hours in the last 2.5 years without a single incident of our person transmitting COVID or any other infectious disease to an employee. Don't let all those protocols slip away. We put out an ebook, and if anybody's interested, we could share the ebook. It's very COVID driven, but it should be for any infectious disease. We don't know what the next one's happening. It's going to come within the next 3 to 5 years. We don't know what it's going to be, but there's ways to prepare your organization. I have a new puppy. We puppy proof the house. You baby proof the house. Infectious disease proof your work environment. That is the issue of technology. So maybe I'll just put the slide up again without going too deep into any of these. If I can get that quickly. Here we go. Safety technology, from wearables to sensors. They started about 5 years ago. And today, if you look out there, there's a plethora. We represent 2 different types of wearable sensors. We represent exoskeletons. We represent motion capture, desktop ergonomic software. There's a plethora of technologies. So one of the challenges for EHS going forward is, how do I navigate that? How do I just not go to a conference and say, oh, I saw this cool sensor technology, we ought to use it because probably it actually could be of help. But how do you navigate that? So you got to make sure that you have some expertise around you to navigate that, because first of all, there's companies being born every day that are enhancing that technology and bringing the next revolution or version and bringing more and more to the table. So how do you know where to go and how to do it? So I would say find a group for safety technology that is technology agnostic, that isn't focused on one or two technologies, because if they are, that's all they're going to try to do is sell you those one or two technologies. Two, really look hard. Do we need that technology? I've had people call me up and say, hey, we heard about your stuff. We see your sensor technology. We'd love to do it. I'll be honest, or exoskeletons. I will spend probably a good 20 minutes challenging them hard, almost trying to talk them out of it. Not necessarily that, but challenging the thought process to make sure that they've actually done the assessment work and understand the data and the risks before they say, I'm interested in exoskeletons or I'm interested in wearables. So navigate this clearly. Two, we talked about the infectious disease, the mental health, the wellness. There's apps out there that can help you with that. There's programs that we've developed that are in apps that can, people, mental health awareness. We don't diagnose, we're not that type of company, but we have educational content. More and more EHS should be developing more educational content. And we're finding we're doing a lot of that Ergo 101, we call it Ergo Aware. And then there's a 201 course and a 301 course. The more you can touch more people with education and engagement, you now took that totality of responsibility from the EHS director or the safety manager to the organization as a whole. So that's where it's going. And I think it's going very rapidly because, like I said, I think in the last 3 months, we've had like 10 assessments and some educational webinars. So we're doing digital assets of training that people then can access on the LMS system of the company. It's just going at a very rapid pace. And so you have to be able to keep up, but you also have to be careful not to just get sucked into the next shiny object. You have to be able to really partner with somebody who's had experience with most of these to be able to help navigate where the right answer is. But as you can see from the pie graph, that's where EHS is going. And so when you think about budgets, and maybe this year it's a little late for that, and here's a good example. I have a potential client, not a client yet, talking to him, he said, I think we need to do something, but I'm not sure yet what. I said, okay. We talked enough that I kind of knew what they were thinking about or what they might need. And I said, here, I'm just going to give you some budgetary numbers. They're not a proposal. It's not here to sell you X, but I'm going to say you probably need these couple of 3 things. Put aside X number of dollars in your budget. And when somebody's challenging you, say, what's it for? Say, we're not sure yet, but we know we need to do certain things next year to get our incident rate down or to protect our people from infectious diseases or whatever it is. Here's what there's multiple things we think we need to do. We're not sure yet, but I want to be able to put aside 20 grand, 50 grand, 100 grand, depending on your company size and wherewithal, to address that so that I don't have to fight for those dollars 3 months from now or 6 months from now because it wasn't in the budget. So that's another piece of it is, even if you don't know what you're ready to do yet, put some money aside but have an idea of multiple things you might want to look at. So again, it's not just some number you pulled out of the air and say, this is where we need to go. I hope that answered the viewer's question.
That's great advice. Thank you. I love that. Well, thank you so much for your time, Kevin. We appreciate you sharing your expertise. And I will turn the time back over to Ty.
Thank you, Sarah. I appreciate your time. I appreciate you asking us to be part of this. And if anybody wants to reach me, please feel free. Here's my email and feel free to reach out.
Thank you, Sarah, and thank you, Kevin, for all the great guidance and info. And in order to remain on schedule, we'll respond to the questions that came in via chat, by email, in a timely manner. So with that, on behalf of Safety News Alert, I would also like to thank everyone for attending. This concludes our program.